Anemia is a condition characterized by a deficiency in the number or quality of red blood cells, which are responsible for carrying oxygen to the body's tissues. Classification of anemia. Anemia can be classified in several ways, often based on the underlying cause or the appearance of red blood cells. 1. By red blood cell size. Microcytic anemia, small red blood cells, often due to iron deficiency. Normocytic anemia, normal-sized red blood cells, but in insufficient numbers, often associated with chronic disease. Macrocytic anemia, large red blood cells, commonly due to vitamin B12 or folate deficiency. 2. By underlying cause. Iron deficiency anemia, caused by a lack of iron, often due to dietary deficiency, blood loss, or absorption issues. Vitamin deficiency anemia, due to a lack of vitamin B12 or folate. Anemia of chronic disease, associated with chronic infections or inflammatory diseases. Hemolytic anemia, caused by the premature destruction of red blood cells. Aplastic anemia, the bone marrow fails to produce enough blood cells. Anemic syndrome. Anemic syndrome refers to the collection of signs and symptoms associated with anemia, reflecting the body's response to decreased oxygen delivery to tissues. Symptoms of anemia. Fatigue and weakness. Pale or yellowish skin. Shortness of breath. Dizziness or lightheadedness. Cold hands and feet. Chest pain or irregular heartbeat. Headache. Diagnosis of anemia. 1. Complete blood count, CBC, to measure levels of hemoglobin, hematocrit, and the size and volume of red blood cells. 2. Blood smear, examines the shape and size of red blood cells under a microscope. 3. Iron tests, to check levels of iron, ferritin, and total iron binding capacity. 4. Vitamin B12 and folate tests, to determine deficiencies. 5. Bone marrow tests, in some cases, to assess the production of red blood cells. 6. Additional tests depending on suspected underlying causes, such as tests for chronic diseases or hemolysis markers. Treatments for anemia. Treatment depends on the type and cause of anemia. Iron supplementation, for iron deficiency anemia, through diet or supplements. Erythropoiesis-stimulating agents, to stimulate red blood cell production, often used in anemia of chronic disease. Vitamin B12 or folate supplements, for deficiencies in these vitamins. Blood transfusions, in severe cases or where immediate treatment is needed. Treating underlying conditions, such as controlling chronic diseases or stopping sources of bleeding. Bone marrow transplant, in cases like aplastic anemia, where the bone marrow is not functioning properly. Early diagnosis and appropriate management are key to effective treatment of anemia and preventing complications. If you suspect you have anemia, consulting a healthcare provider for a proper evaluation and treatment plan is essential.